One of the biggest costs is healthcare. Whether you're paying a premium plus other out-of-pocket costs, covering the high costs of prescriptions before retirement, or looking ahead to retirement, health costs are simply hard to plan for. In today's segment, we're going to talk about possible ways or tips to save on health costs and some resources. Allow this segment to help you spark a conversation with your financial advisor or your employer's benefit coordinator or your financial accountant as you plan to save for the year ahead and save for your future. If you haven't done so already, please hit the like button and the subscribe button so you can stay connected as we discuss finance tips as you are on the go. So we're going to discuss some ways that you can save. And one of those ways are healthcare pre-tax health options or medical options, if you will. So some of the common ways to save you may have heard about are an FSA, flexible spending account, or an HSA, which is a health savings account. When you're planning ahead for your FSA or HSA, you have to provide how much you want to place in that account for the year in advance. And the best way to do that is to look at all of your household medical expenses, including prescription costs, and look at maybe 3 years worth and an average of what you spent each year for the past 3 years, and now help you get to an annual amount that you're likely going to spend in the upcoming year for medical expenses. And so that's one of the good ways to estimate how much you need to deduct to go into an FSA or HSA plan. Now, both of these plans through your employer is a deduction from your paycheck over time, over the course of the year, but these are pre-tax accounts. So it helps you save at the end of the year by reducing your taxable income. So in addition to other retirement contributions and other ways you can reduce your taxable income, if you utilize these accounts, you can further reduce your taxable income for medical expenses that you're likely going to pay anyway based on your history. So let's talk about the FSA or flexible spending account. Okay, so we already mentioned that you're going to estimate how much medical funding you need for the year. Okay, and the FSA accounts, you have to be careful on how much you say you're going to need for the year and you want deducted from your check, because oftentimes 100% of what you did not spend throughout the year on qualifying medical expense does not roll over for your benefit in the next calendar year. So this differs from employer to employer. So before you choose an amount for your FSA plan, be sure that it's an amount that you are going to spend throughout the year, because 9 times out of 10, that unspent balance will not roll over for you to use the next year. Now, the HSA account, okay, the health savings account, this is offered under an employer HDHP or high deductible health plan. So basically, if you're going to have a lot of medical expense that particular year, when you choose a medical plan where you have an attached HSA, you're going to end up paying higher deductibles if you didn't choose this particular plan. So it appears more beneficial if in the immediate future you do not have very expensive or a high volume of medical costs. The benefit of this particular account is that it does reduce your taxable income, but it also remains to be funding that you can pull from even after you terminate from your employer. So that's the difference between the HSA and the FSA, is that with the HSA, you can still use it for qualifying medical expenses even at retirement. The 2023 HSA contribution limits, or how much you can put into this account, changes from year to year. And for 2023, it is $3,850 limit for single coverage, or $7,750 limit for a coverage for yourself and at least one family member under the high deductible plan. Retirement and HSA. There is a withdrawal penalty if you do a withdrawal and it is not a qualified medical reason or expense. So when you're thinking about using your HSA account in the future, particularly in retirement, you want to keep good records, keep all of your receipts, and ensure that you are spending that funding on qualified medical reasons. The normal retirement age is 65. And just remember, if you do withdraw money and it's not a qualifying medical reason, you'll be subject to a tax penalty of approximately 20% for non-medical withdrawals. And another note or thing for you to take note of is that you cannot contribute to an HSA once you are enrolled in any Medicare plan, Part A or Part B. For more information regarding how your HSA plan will work in the future or currently, speak to your employer's benefit coordinator or retirement expert and research details for yourself so you can plan out for your future. Now, we have medical expenses that can be high in costs, but some of that medical expense related costs are prescriptions. And so GoodRx is a good resource that can help you lower your prescription costs, and it can also help you shop online to see which stores or which vendors have a higher cost for a particular prescription drug that you need to fill. GoodRx also has a premium gold plan or a gold premium plan that allows you to get even more of a discount for a minimal monthly costs. So I found this resource to be great in times where I haven't had medical insurance and helped reduce my prescription costs. Now, some of the other healthcare options that we may be familiar with are COBRA. When you terminate employment, an employer that has 20 or more employees must offer you COBRA insurance, but that only lasts for approximately 18 months. Another thing you can look into, you can see if your state is participating in the Affordable Care Plan. I'm going to include a website where you can research yourself if you don't have healthcare, what are the premiums in your area, and see if that is an option that can work for you. Another option you can do to get healthcare is to buy direct from a healthcare insurance agent. And so they can help you purchase from the private marketplace. This may be a more expensive option than an Affordable Care Plan or even COBRA, but you just have to check with agents in your area. You can also look into any part-time jobs. If you don't have a job or you can't work full-time, to see if there's any part-time jobs that may offer some type of health care benefits. And that's something you can just look into up front as you are filling out applications. And during my research of healthcare costs, I also ran across some countries that are marked or said to have the best healthcare systems. And I'm just going to read those off. It's Canada, Denmark, Sweden, Norway, Germany, United Kingdom, Japan, Australia, the Netherlands, and Switzerland. Now, we all can't pick up and go just because we want to reduce our healthcare costs. But I hope that some of these tips have been helpful for you when you're considering lowering your current healthcare costs and taxable income to benefit that way, or as you're looking towards retirement and what you can do now to kind of prepare for that. Again, speak with your financial advisor or your benefits coordinator at your employer to find out more information about how your plans work for you. Thank you for joining today, and I hope to see you next time.